Welcome to the last day of Devcon. Really appreciate you all still coming here after such a long and incredible week. This is actually my 5th Devcon, so I'm really excited to be here, to have the honor to speak today. It's the 3rd time I'm speaking, and it's just really incredible to see how the space has advanced. So I'm here today to talk to you about DeSci. Scientists today, roughly, at least the scientists that we spend 80% of their time applying for funding, and 20% doing the science. Academia, scientific funding, and even the biotech VC ecosystem is really broken in the sense of like how we distribute and access and fund innovation. Imagine if software developers had to spend 80% of their time getting funding to write a piece of code and only were coding 20%. Like, that would take us back into the 80s and 90s. And that's essentially where our scientific innovation ecosystem is stuck. So we have the fundamental hypothesis that most of the world's potential scientific talent actually today remains untapped. We live in a time of science friction, not of science fiction. Those super cool solar punk like cities, we're only going to get there if we actually upgrade the way that we do innovation. So this is a Nature report that recently came out. A scientist that treated her own cancer with viruses she grew in a lab. She treated herself with this, and the response was that this under-the-radar, stigmatized and ethically fraught practice, essentially scientists shouldn't be doing this. And there's a really cool comment, scientist does science, cures cancer, the science, no, you can't do that. And then you wonder why scientists are fleeing academia. So DeSci, decentralized science, is ultimately really about making science permissionless. In the same way that we have permissionless money, we should have permissionless science. This is the typical innovation and drug development cycle that happens within a firm. This process today takes up to 10 years and costs upwards of $2 billion. And within here you have, this is like one company, for instance, trying to cure cancer. Instead of all working together globally in a globally connected marketplace, each company does work by and in of itself. So what we developed is, on Ethereum, is something called an IP NFT. It's a combination of a legal contract, a smart contract, and then you encrypt all of the secret sauce, the private data, on a combination of Arweave and Filecoin. This mechanism to date has funded over 2,000 ETH in research across the world. This, for instance, is the research portfolio of VitaDAO, one of the leading DeSci DAOs that exist today. So there's an ecosystem now of DeSci DAOs that are all actively using this framework to fund research on Ethereum. This, for instance, is with University of Copenhagen, University of Oslo. We have one project with Newcastle University. If any of you are into longevity research, the project that we funded at Newcastle is about autophagy activators. And these new drugs that are being developed that are 100% now owned by a DAO are actually proven to be 2 to 3 times more effective than rapamycin. Rapamycin being the other leading longevity drug. This is 100% owned on Ethereum now. This happens, as I said, through an IP NFT. There's a further governance framework that we developed, which are called IPTs, which essentially make individual research projects now tradable. I'll go through a little case study. Sorry, it's very fast-paced. It's a lot of ground to cover for 5 minutes. So this project was funded for $90,000 in May 2023. It is about longevity gene therapy. It was then tokenized. This is how the IP NFT kind of looks on chain. And then here you can kind of see a public tokenization event where now members of VitaDAO can publicly contribute to funding this. Then a DEX Uniswap liquidity pool was launched. And what happens now is you have a live market that becomes really hungry for data, which typically doesn't happen. So all of the market participants, the token holders, are constantly in touch with the researcher, trying to find out how the research is going. So since then, he's released a whole bunch of data. This is a biotech developer who's also new to crypto. So we're bringing an entire new user base really into crypto. So since 2023, we've now built over 7 of these different BioDAOs that have in total sourced over 2,000 projects and essentially moved over 20 million of science on chain. We have one focused on psychedelic research, for instance, another one focused on hair loss, cryogenics, neuroscience, and we're building more and more. One of the most exciting ones for me is a DAO focused on quantum biology, with one of the world's leading researchers from MIT that is now coming on chain to build a quantum biology-focused DAO. So what data points do we have today? We have over 2,000 projects that were evaluated. Approximately only 0.5 of them got funded. 13 projects funded on chain, over 3,000 ETH deployed. We're developing 5 to 6 new medicines. We have first real-world products. This is one of the first products that VitaDAO has brought to market. It's a high-dose spermidine supplement approved by the Thai FDA. If you want to learn more, we'll be here in a bit. But now the question is, how might we get to 100,000 projects? How do we actually increase the throughput? How do we get to 100 medicines? How do we actually get to a world without patents? One will be through open curation markets, so building autonomous marketplaces and exchanges that can massively increase the scalability and curation of projects. If any of you have heard about bonding curves, I think are one of the most exciting innovations to actually curate not just memes, but curate science, curate research. However, science and biotech really requires large sums of money. So the next question should be, how might we inspire millions of patients to come on chain? Let's be honest, most of the world still sees crypto as a giant casino. Hasn't solved that many real-world problems yet. But here, we actually have potential to inspire millions of people by solving real problems. We could fund a malaria vaccine. We could fund a clinical trial. Nation states typically invest 4 to 5% of their GDP into funding basic research. If we consider blockchains to become nation states or network states, then we should do the same. And a super small example here to kind of just to leave you with, if ETH stakers redirected their rewards, so do this voluntarily, redirected rewards to funding basic research on chain, Ethereum would have an R&D budget just from 10%. From 10% of ETH staking rewards, Ethereum would have an R&D budget the size of Singapore. So we could fund 4 or 5 malaria vaccine trials a year. And actually, if you think about that kind of impact, I think we've been scaling so much for throughput, but we should be starting to think about scaling for impact. So we want to build towards this world where scientists spend 80% doing the science, 20% applying for funding, where anyone in the world can fund and participate in science independent of institution and geography. Thank you so much.
Thank you. Thanks a lot. You see that this topic matters, right? You heard the applause. What? You heard the applause. This topic matters to everyone.
This topic matters. Sorry, I ran a little bit over.
Yes.
Thanks, Paul. Can you explain a little bit to me about how you go, the protocol goes about validating projects to make sure that the funding they're seeking is for a worthwhile project, and what's to stop just somebody just posting up a rubbish project? That's the first question. Second question, once you have found one, it's listed, it's got the money, it's actually got a product and solved something, you still have to go through FDA approval of some sort somewhere, like you did for that Thailand. Does that then take you back into the quagmire of that process you're trying to get around?
100%. So this product was actually approved by the Thai FDA. But leave that aside. The biggest bottleneck in funding basic science or funding research is in the early stages. It's in kind of the sweet spot between 100 to 500K. This is typically called the valley of death in academia. There's been hundreds of articles written around this. No one has a solution to this problem. I think we might have something here. To answer your question really specifically, capital markets are among the best ways to curate things. Right now, a lot of the funding is permission, in the sense that it's semi-permission. I presented these numbers, 2,500, and roughly only 0.5% were funded. It's not that most of the other ones were garbage, it's just the space has such little funding. Some of these DAOs have been operating with shoestring budget. It was like 750K, 1 million through 1.5 years of a bear market, and actually funding research with it. It's not just ops cost. But we're now moving from like a permissioned way where token holders vote, and then you have a scientific community and like a scientific advisory board that actually reviews proposals in a similar way that the NIH would do, that grant proposals are reviewed. So it's very, very professionalized. In the future, though, I think to really scale throughput, we're moving into much more permissionless designs. One thing I think that we could dig up again, if any of you are still familiar, token-curated registries. I think that could be a really interesting way to have token holders upvote and downvote which projects should get funded. And then the other way is really, I think, we can laugh about pump.fun. It's a weird little thing, but it's actually to currently very quickly birthed more crypto unicorns than ever any other platform ever before on a short time frame. I think a similar thing in a safe way could be applied to science. So if we take out some of the crazy speculative aspects and make it a little bit more tempered, that would be a great way to actually boil the ocean to get a lot of early stage innovation funded.
Thank you for the thorough answer and a great question. One more. There. But let's be fast. We are like super short on time. Short question, please, and a short answer if possible.
Yes. So I guess, how do you think about the ethical stuff? So like that cancer, the doctor curing your own cancer, like that's an ethical issue. That like, how do you basically think about that when you're funding and vetting? And does this solve this in any way? Or yeah, how do you think about this framework?
100%. So, I mean, so actually, if you dig deeper into this and you're like fully permissionless science, biosafety and all of that actually becomes a much bigger concern. So with regards to ethical considerations, it's like we're a neutral platform in the same way that Ethereum is a neutral platform. I remember in the early days of Ethereum, people were really worried about this one use case, which was like, what if we have assassination markets on Ethereum and like anyone could create a smart contract that someone gets assassinated? It never happened. I actually think that fully open systems are much better at regulation than existing regulators. So like we have really bad stuff that came onto the market through the FDA, namely OxyContin, all of those opioids. Like the regulator isn't much better at protecting the public from, I think, what an actual system is. So if you ever did have something that was really concerning come onto a market like this, I think the market self-regulates. On the other hand, it's always about the funders. And so I actually think this becomes really powerful if funders of these things are patients. Imagine if a new diabetes drug was 40% funded by patients. Like what would they do to access and to pricing? They would probably be much more interested to offer it to as many diabetics as possible at as low a price as possible. And so I think, because the early funders in these communities are in fact patients or people affected by this, one of the most successful communities is HairDAO, which is comprised of hair loss patients, and I'm